While studying a disease, one must remember that only a limited number of remedies are applicable to a particular disease condition. However, while studying a single remedy, one must remember that it may be applicable across the wide range of diseases, provided it matches the totality of the patient's symptoms and constitution. Asafoetida does cover the symptoms of GERD, symptoms of dyspepsia, symptoms of hysteria, but it is not limited to these only. It also covers many other diseases, many other symptoms which we are going to discuss. Certain gems from Materia Medica. In homeopathy, there is not a single remedy or a one remedy for all patients of a particular disease. Our remedy changes according to the individuality of the patient. Unless and until characteristic symptoms are matched, the essence of remedy is matched. No remedy can cure the patient or disease. Asafoetida was introduced in Materia Medica by France in 1822 and Dr. Hahnemann himself contributed to the proving. Asafoetida belongs to plant kingdom and the scientific name of plant is Ferula asafoetida and Umbelliferae family. It is a carrot family. It has carrot-like roots and these roots exude milky sticky gum resin when damaged. The resin is extracted from the roots. The dried asafoetida we consume in our daily life is a dried form of this resin. And the mother tincture is prepared from the gum resin extracted from the roots of Ferula asafoetida. As its name suggests, Asafoetida, it has a fetid smell and pungent taste, and hence it is called devil's dung. In India, it is called hing. It has many health benefits and medicinal properties, and hence people use it in their daily life, in cooking, in food, in the form of condiments or spices. It has been traditionally consumed all over the world. The health benefits are, it is a very good source of antioxidants and it is very good for digestion. It is used for the treatment of stomach ache, flatulence, dyspepsia, intestinal parasites and for weak digestion. It reduces the symptoms of IBS and it is also used as a laxative. It is used for the treatment of infantile pneumonia because it reduces the symptoms of asthma and bronchitis because it has antispasmodic and expectorant properties. It has antibacterial, antimicrobial and antifungal properties. And it is also used as a immunogogue. Immunogogue means to promote the menstrual discharge. The sphere of action of Asafoetida is nerves, mind, esophagus, digestive tract, bones, especially periosteum of bones of nose, ears, tibia, and it is a one-sided remedy, left-sided symptoms. Through the cerebrospinal nervous system, Asafoetida has 3 special centers of action. It is written in Burt's Physiology. First is muscular system, second is glandular system, and third is mucous membrane. First is muscular system. Through the cerebrospinal nervous system, Asafoetida produces the hysterical insanity of any or all of the muscles in the body, especially centering upon the esophagus. Here on the esophagus, it produces constant muscular spasms, feeling like a large lump in a throat that can be swallowed. That is globus hystericus. Second is glandular system, especially centering upon the ovaries, mammary, testicles. It produces the hypersensitiveness and increased secretions with swelling and induration. Hence, menses become too profuse and too early. Then third is mucous membrane. The action of Asafoetida is to increase all the mucous secretions, especially the digestive organs, mucous secretions of digestive organ and lungs. On the mucous membrane of digestive organs, it increases the intestinal secretions. That mild catharsis is produced. Catharsis means purgation with great tympanitis of the whole abdomen. In larger doses, it produces colic, nausea, vomiting, increased biliary secretions, augmenting the peristaltic action of the intestine with copious watery diarrhea. This is the toxicological information of Asafoetida. Asafoetida has most marked action on nervous system and it produces many nervous symptoms like hysteria, hypochondriasis, fainting fits, spasms, epilepsy, chorea, neuralgia, etc. It is very useful remedy in practice in cases of hysteria and hypochondriasis. And the peculiarity of nervous symptoms is that all the nervous symptoms come on after the cessation of or suppression of habitual discharges or spleen symptoms. And hence, we have to ask the patient about past history, how hysteria started or how a nervous system started. This is very important. For example, suppression of leukorrhea, suppression of menses. Hysterical symptoms arises from suppression of leukorrhea or menses or any kind of external healing of running ulcer, checked perspiration, sudden cessation of long-standing chronic diarrhea, sudden checking of chronic expectoration, check perspiration, etc. Hysteria means it is a term used to describe emotionally charged behavior that seems excessive and out of control. When a person responds that seems disproportionately emotional for the situation, they are often described as being hysterical. And hypochondriasis means it is an anxiety disorder, anxiety about health, illness anxiety disorder. Worrying that minor symptom or body sensation mean you have some serious health illness. Being easily alarmed about your health status or finding little or no reassurance from doctor visit. That is hypochondriasis or negative test results. Patient is very much fearful and anxious, apprehension of dying, fear arising from abdomen, stomach, magnifies the symptoms, craves sympathy, hysteria with much trouble about the esophagus or throat, clutches the throat during hysteria. These are mild symptoms. The next characteristic symptom of Asafoetida is oversensitiveness and fainting. Physical and mental oversensitiveness. Though the patient is of stout aspect, heavily built, flesh and flabby, fat patient, yet he is intolerably nervous and oversensitive, sensitive to noise, physically and mentally. Cannot bear the slightest contact or touch. Ulcers or skin eruptions are very much sensitive to touch. Pain is aggravated by slightest touch. And second is fainting. Fainting due to any reason, especially from emotional excitement or disturbance. Fainting from noise. Fainting from being in a crowded place. Fainting during pain without any cause. Here, fainting is a coping mechanism of Asafoetida with pain or any kind of sensitivity from external situation. Sensitivity to external situation. The sensation of umbelliferi family is sudden, unexpected, violent attack, shocks and blows. And how the patient cope up with this sensation is by avoidance, by fainting. There is no panic in response, but avoidance. There is another grand feature running through this remedy is it is full of discharges. All the discharges are horribly offensive and echoious, means thin, watery, acrid, blood-stained and purulent discharges. Discharges from ulcers, from skin eruptions, catarrhal discharges like expectoration, leukorrhea, menses. Discharges from nose are very offensive, that is ozena. Otorrhea, discharges from ears. And even watery stool, diarrhea is very offensive. Then next is ulceration, gangrene, necrosis and venous stasis. The peculiarity of ulcer is that the ulcers are very deep and burrowing in ulcers with bluish edges, indurated margins and surrounded by varicose veins. Ulcers are very much sensitive to contact, sensitive to touch. Pain is aggravated by slightest touch. Inflammation of bones, especially the periosteum, ulceration of bones, periosteum of nose, ears, caries of mastoid bone, then caries of tibia, bone caries. Ulceration from burns and scald. Ulceration at the site of old scald. Old scar turning bluish in color and threaten to suppurate. Then skin adhere to the bones in ulceration with indurated margins. Old scar turn purple, threaten to suppurate and corneal ulceration. Then terribly throbbing pain, which is aggravated at night and by slightest touch. Itching is better by scratching. And suppression of skin symptoms or suppression of discharges produce nervous disorders. The another feature of Asafoetida is neuralgias. Very useful remedy in cases of neuralgia. Ciliary neuralgia, orbital neuralgia, deep-seated inflammation of eyes, iritis, then retinitis, superficial ulceration of cornea, and throbbing and boring pain in eyes, aggravated at night and accompanied with numbness. Then female symptoms. Women who are not pregnant sometimes have breast filled up with milk and sensitive to touch, and the main cause is hormonal imbalance. It has also deficiency of milk. Days after delivery, milk diminish. Means deficiency of milk in nursing woman. Then uterine ulceration, a very useful remedy for palliating the uterine cancer. Ulcers are sensitive and painful. Women who are feeble, flabby, having venous constitutions are easily prone to nervous disorders, ulcerations, hemorrhages and miscarriage. Then general modalities are aggravated at night, aggravated by warm application, aggravated at rest and slightest touch, and amelioration in open air by pressure and by motion, from motion. GERD symptoms of Asafoetida. This remedy has many gastric and abdominal complaints, full of bellyache, stitching pain, colic, diarrhea, then reverse peristaltic movement of esophagus. Feeling of ball is rising in a throat, as if ball is rising in a throat, that is globus hystericus. This is due to choreic spasms of the esophagus. What Dr. Kent has written in his book, in Kent's lecture, in stomach trouble, if you have ever seen a typical case of Asafoetida, you will wonder where all the air comes from. It comes up in volumes. Means there is so much accumulation of gas in abdomen. It comes up in volumes. Hiccups like contraction of diaphragm, choreic jerking of diaphragm with expulsion of wind, like the sound of pop gun going on almost every second. Enormous accumulation of flatulence in abdomen, all pressing upward but none downward, full of wind, seems as if she would burst with the upward pressure. Loud belching, loud eructation of wind from stomach. Great difficulty in bringing up the wind, great distension of abdomen, spasmodic tightness in chest, as if lung could not be fully expanded with palpitation like tremor. Forcible eruption of gas with pulsation in the pit of stomach, perceptible to sight and touch. Violent gastralgia. Abdomen is distended with sensation of emptiness and hunger. That is all one sensation in stomach. Emptiness and hunger at 11 am, just like sulfur. And about constitution, what Dr. Kent has written in his book, patients often say, I get no sympathy when I am sick because I look so well, fat, flabby and purple. This remedy is seldom thought of in a lean person. Means person is very flat and flabby. But in flat, flabby person, extremely nervous, extremely sensitive to pain, full of hysteria. Purple when in the cold, purple when excited. In other words, you see before you the venous constitution, and these people get worst kind of hysteria. They goes off from no cause into fainting. This is what Dr. Kent has written in his book. In Comparative Materia Medica, we can compare Asafoetida with moistures in cases of hysteria, fainting fits, convulsions, and with mercury and aurum in cases of gangrene, necrosis, ulceration of bones, and night aggravation of pain. And we can compare Asafoetida with sulfur in cases of GERD symptoms and venous constitution. There is a gas formation in volumes, great tympanitis of abdomen with chest tightness, and pulsation in stomach, in pit of stomach, which are perceptible to sight and touch, with great accumulation of gas in abdomen, and anti-gone feeling in stomach, hunger at 11 am, similar to sulfur. Asafoetida's distinctive smell is due to sulfur containing compound. Sulfur is one of the constituent of Asafoetida.